Okay, hello. My name's Rosie from Onelife Training.
I'm Steve, also working at Onelife Training.
We're going to talk to you today about seizures and how we manage seizures in first aid training courses. So, do you want to start off, Steve?
Seizures is a very general term for somebody having some form of attack for some reason. A lot of people confuse with epilepsy, and you do get seizures with epilepsy, but epilepsy is a diagnosed condition that somebody will know they've had, unless it's the first seizure, of course. But anybody can have a seizure. I've certainly had one or two myself as a result of trauma, from head trauma. So it could be anything. So if you see a seizure, don't assume epilepsy. You have to treat the seizure. So as always, treat what you see.
Yeah. And seizures come in all sorts of different forms, right?
Yeah.
We get a lot of questions in first aid courses about how does a seizure present? What does a seizure look like? How would we know somebody's having a seizure? But really the common seizure that we're talking about here is your tonic-clonic seizures, your full-body generalised seizures, where somebody collapses on the floor. And the common things that we see there is sort of the shaking movements, jerking of the body. But we might see some things that maybe we weren't expecting to see as well. So maybe frothing at the mouth.
Froth at the mouth. You might get people biting, clenching the jaw. It's a loss of control of your muscles, really. So you get all sorts of strange, jerky movements. Yeah. People moving their arms and legs around.
They might even wet themselves.
Yeah, people lose control of their bodily functions. Yeah. Which is something to bear in mind. You know?
So it's particularly shocking, isn't it, really, for somebody who's witnessing that. For the person who's having the seizure, often they don't know what's going on.
Don't really know. I remember I had a seizure about 30 seconds from a bump to the head, and I don't remember anything about it much. That I felt like I was on a roller coaster, being shaken around. So the person is experiencing something unpleasant. So your patient is going to experiencing an unpleasant sensation of some sort. Yeah. So bear that in mind.
Yeah, and some of the things that we've been taught in the past, I'm sure you've had some funny questions.
Classics.
I've definitely had some funny questions. Can you give some examples?
Well, the best one is, because you do clench your jaw, there's a worry that people bite their tongue, bite their mouth. You put something in the mouth, like a wooden spoon or a piece of wood, to stop people biting the jaw. Throughout first aid, we would say never put anything in anybody's mouth for any reason. Don't put your fingers in, because somebody might... people think, oh, we'll maybe scoop something out of the mouth. Don't put fingers in people's mouths, because they may spasm, they can bite your finger. If you put something in someone's mouth, they might end up swallowing it, and you've got a blocked airway, so you're just adding it to the issue. Don't put stuff in people's mouths.
Yeah. And people really misunderstand that, don't they? Because they think, oh, the person's unconscious, you know, or they're not with it, they're out of it, they're not responding normally, so they're not going to bite me, they're not in control. But actually, spasm and seizure can be very, very common, can't it?
Yeah.
And when the jaw spasms, they can really bite down and really do an injury. But also we could cause further injuries and further problems by sticking our fingers in people's mouths. There are no fingers in mouths at any point.
No. You're always trying to, with the airway, the airway in the body is sacrosanct, so you always try to maintain the airway, and so you don't put anything in there. There's no reason to as a first aider, so just leave it. It's unpleasant when someone is biting. They might be biting, they might be bleeding from the mouth. There's really not much you can do about it at that stage. When someone's in seizure, you don't want to be fighting people. You almost got to stop and wait for it. You've got to stop and wait for the seizure to stop. Because there's no point trying to restrain people, because they've got a lot of strength. And you end up injuring yourself, causing further injury to them. You have to leave them, which is a hard thing to do if you want to get stuck in, but you do have to leave them, because the seizure will stop. Then you go in and do your normal stuff.
Yeah, and often if you do see that bleeding from the mouth, that is normally just indicative that they've nipped at the gum or the tongue. It's not normally anything any more serious than that. And for the untrained first aider, seeing someone bleeding from the mouth is quite scary, isn't it?
Blood's always scary, but don't let blood throw you. Yeah. If blood coming out of the body is not great, but it doesn't need to be life-threatening. Yeah. In many situations, it's just something. It's an indicator, but don't worry about it. We've got quite a lot of blood, so we can afford to lose a reasonable amount. Just a trickle from the mouth is one thing. You've got bigger things to deal with. Yeah.
So seizure management is quite straightforward, isn't it, really? Very straightforward for the first aider. What's the first thing we might do, Steve, in seizure management?
Well, first of all, really, in some ways, you're not doing anything. As I said, you can't restrain them. You try and, if they're near dangerous object, you move the object away. If you've got soft items, I know it's difficult, there's not always cushions and things lying around, but you might have coats or something like that. Anything soft, try and put it around them, around their head, around their neck, to stop them damaging themselves, put anything around them you can that will stop them hurting themselves from moving too much. But I say don't restrain them. You know, you sort of stand near them wary, and if you can stop them hitting themselves on maybe a sharp object or something, it's easy to move the object if you can.
Yeah. And comfort them and reassure them and talk to them all the way through.
As with any casualty, always talk, because you're also talking to the bystander to reassure them, you're talking to yourself, and they may be able to hear you, they may be aware of something. Just because they seem unconscious or unresponsive, they may be able to hear you. So any reassurance you can give them is good.
Yeah, and that's a big assumption I think that a lot of people make, isn't it? That this person can't hear you or are not aware. But if they do come in and out of those levels of awareness, at least they're going to know that they're being looked after, that they're being cared for, and that somebody's in control of that situation. So that's really, really important. The psychological impact of knowing that somebody's looking after you, somebody's got it under control, is really, really important. So we've cleared the area, we've made sure that they're as safe as they can be, we're not holding them down, we're not getting the wooden spoon out, we're not doing any of that. What's the other important things that we need to do here? Well,
if you can, they say time the seizure. Make a quick note of when it started. In a very difficult situation, you're probably going to forget that. But if you can make a note of the time, it's useful for future medical knowledge.
It's quite easy to do that nowadays as well with our tech devices, isn't it?
I mean,
just screenshot a phone.
Look at it. You know, it's 17 minutes past 11. Just try and remember that. You know, don't need stopwatches and things. Try what it started about 11:15. You know, if you can. So if this goes on for a long period, most seizures tend to be fairly short in length. Say one I had was 20-30 seconds for all sorts of reasons. But if it's going on for minutes, that's serious. You know, the default for an epileptic, someone with diagnosed epilepsy, is 5 minutes. If it goes on for 5 minutes, call an ambulance. And that's for somebody with known epilepsy. 5 minutes might not seem like a long time. When you're in the situation, that's a very long time.
Yeah, it's a really long time.
So you need to make a quick note of it. And you know, calling 999 is always going to be your call. It's your decision. But if in doubt, get it moving, because ambulance response times these days are difficult. So if you've got any doubt, I would call an ambulance. You can always turn it away later, but once it's rolling, it's rolling. Then if it does go on, it doesn't get better, it gets worse, at least you've got them moving.
Yeah. Okay. And one of our jobs as a first aider is to prevent the worsening of the situation. So the situation can get a lot worse if we leave somebody in seizure. They can end up in something called status epilepticus, which is when the seizure has got to a very dangerous stage, so it hasn't stopped, or it's one seizure after another with no rest in between, and that's both exhausting and really, really traumatic for the body. We can't deal with that, right? Our heart, our brain can't deal with that for too long. So we're getting into the real danger zone if we're going for longer than 5 minutes, if we've got one seizure after another with no rest in between, and also if it's their first seizure. So do you want to talk a bit about why that's a concern if it's somebody's first seizure? What are we worried about?
Well, with their first seizure, they won't know what's happening. Any loved ones or bystanders or work colleagues won't know what's happening, and nobody really knows what it is. So it could be something. Mine was as a result of a blow to the head, so it was as a result of trauma, and that's a good indicator that they've had some previous trauma. If it comes out of the blue, there's an underlying issue there. There's some sort of underlying issue which you sort of need to get to the bottom of. The danger is if it goes on and on, will it affect other things like the respiratory system?